Hello, I'm Jim Hilgendorf. Welcome to America's Dialogue 2. In America's Dialogue 1, we began a great national dialogue about the future of our country. America's Dialogue 1, a video about Hiroshima, nuclear weapons, nuclear waste, and the human cost of militarism and war, was shown in discussion groups all across America during the week of April the 14th to the 22nd, 2007. The video in DVD form or in streaming video format is still available to you and your organizations through our website at www.americasdialogue.org. With America's Dialogue 2, we begin a new phase in our national dialogue, this time on an issue crucial to all of us, national health care. Our new video, America's Dialogue 2, focuses on this issue and will be the centerpiece for this second round of national discussions. Everyone today, especially politicians, are talking about universal health care. But too often it's rhetoric only, catchy phrases that tend to mask the fundamental changes that desperately need to take place in our healthcare system. Bob LeBeau, a former past president of the 14,000-member Physicians for a National Health Program, once wrote, and I quote, "I've found that one of the greatest obstacles to meaningful healthcare reform is the degree to which we Americans are clueless about our healthcare system." America's Dialogue 2 is remedying this need. We're focusing on this issue now because the time is right. In the next few years, if we seize the opportunity, we have a chance to set our healthcare system on the right track. But people need to know the facts. They need to know what's happening. America's Dialogue 2 is a broad-based effort to educate Americans about the problems and choices facing all of us. This video does not have all the answers. It is meant rather to serve as a catalyst for a great national debate, not only about healthcare, but about the direction and future of our country. During the coming months, right up through the presidential primaries of February 2008, America's Dialogue discussions will be taking place all across this land. These discussions are taking place totally beyond the media, beyond governments, beyond supposed centers of power. This is our time to talk. Please join us in this great national dialogue. You're free to copy this video and share it with others. Talk to others. Email friends. Let them know about this project. Watch it on our website. Hold meetings. And after that, let's act, each in our own way. We all have power. Let's make our feelings and our voices heard. Thank you. Americans generally think they have one of the best, if not the best, healthcare systems in the world. This year, we'll spend $2.2 trillion, more than 50% of the money spent on healthcare in the world. Yet, we rank 28th in the world in infant mortality. We rank 26th in life expectancy. Other advanced nations provide comprehensive coverage for their entire populations, while the United States leaves 48 million of its citizens completely uninsured and millions more inadequately covered. Overall, the World Health Organization ranks the quality of our healthcare system a dismal 37th in the world, just ahead of Slovenia. Is all this really true? Yes, it's true. We spend about $7,100 per person a year on health care, more than twice the amount of any other modern industrialized nation, and we still get these kind of results. So what's wrong? Let's hear from some people who are on the front lines working for a better healthcare system. Many of these people live and work in Oregon, where I live, but the situations and problems they're speaking about exist everywhere in the United States. Dr. John Santa has practiced internal medicine and has also been involved in the administration of health policies in hospitals, insurance companies, and doctor groups for state governments.
I've been a physician for 31 years, and I find myself in just very awkward circumstances that, despite feeling that I was in a wonderful profession and tried to make the right choices through my career. That where healthcare is at now in 2007 is very different than where I thought it would be or it should be. The way in which medicine and healthcare has organized itself as a business is disgraceful. Over and over now, I hear from my colleagues, young and old, that we're not doing things that are related to health. We're doing things that are related to making money.
The 48 million uninsured Americans, that's about 1 out of 6, is a uniquely American phenomenon. There's really no other country in the world where you have such a gulf between the haves and the have-nots. There is a whole industry, the health insurance, private health insurance industry, which really doesn't exist in many other countries because they have a government-supported or universal, a single-payer system where it's much easier to administer, much cheaper.
When we talk about a single-payer system, another way to think about it is the pooling of a very large number of people under one agency, which then budgets, collects, and disperses the money to pay for care. This is similar to what we have right now in Medicare. Medicare, as a public agency, gets its funds from Medicare taxes, and from those funds pays doctors, hospitals, and private insurers. The doctors and hospitals themselves are not owned by Medicare. Canada is just one example of a single-payer or large risk pool system. In Canada, coverage is universal, covering everyone regardless of medical condition. Everyone is in a large risk pool, not spread out in hundreds of smaller risk pools covered by different insurance companies as in the United States. Everyone is free to choose their own doctor or hospital and services, and coverage is completely transportable, so if someone changes jobs, the coverage goes with them.
What all of the countries except the United States have is the ability at some level for government to make much more explicit decisions about how resources should be allocated. In our country, we're more comfortable with a system that says, well, we will let the market decide how resources should be allocated. And that's resulted in a very expensive system.
Just how expensive? It's generally acknowledged that administrative costs for insurance companies, which includes marketing, advertising, underwriting, and shareholders' profits, takes up about 25 to 30% of healthcare dollars. This translates literally into hundreds of billions of lost healthcare dollars. Contrast this with Medicare, a nonprofit government system which operates with administrative costs of about 2%.
One of the major factors in the constantly escalating cost of healthcare is this proliferation of all of these health plans, each of which has places an enormous paperwork burden on the local providers. So in the clinic's offices, the doctor's offices in our clinic here in our community, they're overwhelmed with enormous paperwork.
The difficulty of dealing with any individual patient claim is just astounding. Because there's so many different plans, you have to make sure that you're submitting the right bill in the right form for the right disease, for the right procedure. I heard a fellow talking about a trip he took to Canada, and he wanted to look at the billing department of a large hospital, and the initial reaction was, oh, do we have one of those? In fact, they had a small room with a couple of people working in it, and that took care of it. If you could take half of that waste and divide the money up among the uninsured in this country, you could provide private health insurance for every individual.
Americans take it for granted that much of their health care comes through their employers. But this is largely an accident of history. During the Second World War, because of wage and price controls, employers began offering health insurance as extra compensation to attract employees. This practice grew into the current employer-based healthcare system we have today.
One of the really current, interesting developments in the whole effort on healthcare reform right now is the tremendous interest which business and industry now has in trying to do something, face up to the reality of that we have a healthcare system that is about to implode. Many businesses, many industries, many labor unions have finally recognized that this escalating cost, double-digit healthcare inflation year after year after year is way beyond control now, and that they must really address fundamental changes in the structure of how healthcare is provided in order to control those costs. They realize that they are at a tremendous disadvantage in a global economy when our businesses in this country carry such a significant proportion of healthcare costs as compared to other countries that have universal health care, where there is another way of financing healthcare other than through the employer.
At this point, it's collapsing. I think it's been really poignant when we've watched some of the tribulations that automakers and steel makers have had trying to fund the healthcare for their workers. I mean, some people have said that the big three automakers are basically a pension fund and a healthcare fund that happens to also make cars.
So for 30 years I've been working with a lot of small businesses and as a financial manager, accountant, and one of my jobs has been to secure health insurance for employees and to negotiate with health insurance companies. And it's been difficult when you see health insurance going up 10% a year or more. One year it went up 40% for us, so that makes it pretty difficult for small businesses to continue to insure their employees.
As businesses have tried to face the escalating cost of healthcare, one of the things that they have looked to their insurance provider for a more affordable health plan. And what happens in a lot of these situations is that the health plan is so skinny, the benefits are so limited, for example, that really, in fact, it doesn't do the job.
If your employer drops insurance coverage, you're out of luck, particularly if you happen to have a pre-existing condition like diabetes. And the stories go on and on and on.
I can see that life in America is unpredictable, that one can go from being well off to being impoverished pretty quickly. One of the most common ways that happens is to get sick and not have insurance. I mean, I have had patients who have gone from being very solid middle-class people to being absolutely impoverished because they got a health problem that they had nothing to do with. They didn't make any choices that deserved the disease they got. They were just unlucky, and their whole lives and their families' lives have changed forever. It's just an American tragedy.
I was born and raised in Vietnam, and I left Vietnam when I was around 16, and I went to France, and then I lived in France, went to school there. I had to go to the French Army for 1 year, and then in 1995 I moved to America. When I moved here, that's when I ran into that healthcare. It's not an issue, but it was something new for me, because when I lived in France, you know, I went to school, I went to college. Obviously, I had to go to the doctor once in a while. I had to go to the dentist once in a while, but what I remember that I never had to have to worry about losing my insurance. You know, if I had to go to the doctor just because I was sick, then I went. Here, obviously, I've been lucky. I've been working for good outfits that they have good insurance, but you know, there's always something on my mind that, you know, if something happened to me, what happened to my family? What happened to the insurance? Who's going to take care of my family? And that's something that I never had to think about when I was in France.
So what's stopping us from changing our healthcare system? As everyone knows, there are very powerful forces opposed to any change in our market-driven healthcare system. Insurance companies and pharmaceutical companies have poured enormous amounts of money into fighting change, into lobbying our representatives in Congress, and also into advertising and misinformation campaigns meant to create doubt and confusion in the public's mind. A simple example of this are campaigns to discredit Canada's national healthcare system. Ad campaigns and articles focusing on issues like rationing, waiting lines, and people streaming into the United States to get better healthcare have created negative images about Canada's healthcare system that are simply not true.
Rationing of healthcare occurs in our country, all over the country, every day. Patients without insurance do not have access to care until they have an emergency. Patients with insurance, some are considered underinsured because their insurance does not pay for all the care they need, or they can't afford to pay extra for the care they need, so their care is rationed.
Rationing is a reality, and we just need to get together as a community and decide how we want to do it. I would contend that the way we're doing it now is very unfair, unpredictable, arbitrary, and it leaves the decision-making power in the hands of people whose interests aren't necessarily determined by the well-being of the community.
Now, ironically, in the world over, there is no system, I think, that provides less care proportionally to the sickest and poorest of its citizens.
When you look at the so-called Medicare Modernization Act, or Part D, basically pharmaceutical companies wrote that and stipulated that the government was not allowed to bargain to get better prices on drugs, which is appalling and outrageous.
Another very famous statement is the fact that Canadians stream to the United States to get health care because the healthcare system in Canada is somehow not up to snuff. But in fact, I've heard that described as the tip without an iceberg. It's just very few people come to this country for medical care. Very few doctors come from Canada to the United States to practice. In fact, last year it was more American physicians moving to Canada to practice than the other way around.
My name's Jo Alexander. I'm originally from England. My mother died about 18 months ago. She was 92, and watching her in her last years made me very, very conscious of the difference between the healthcare system in America and in England. The operative word in England really is health care. The doctors and the nurses do their work out of care rather than because they're looking for large incomes. My mother was able to live alone in an apartment until she died because there were social services that the people were coming in to help her every day. People now in England have to pay a very small amount, about $6 or $7 for a prescription, but once you're over 65, you don't have to pay at all. And she would simply telephone the pharmacy, tell them that she needed a refill, and the next day the little package would be delivered, hand delivered to her house.
Several states are implementing or trying to implement new health care plans within their own state. But these plans, in one way or another, are still compromises with an employer-based healthcare system and a profit-driven insurance industry. In August 2006, though, the California state legislature actually passed a new law creating a single-payer healthcare system for the entire state of California. But Governor Arnold Schwarzenegger vetoed the bill. The bill was reintroduced in February 2007, and a broad coalition of groups are once again pushing for its passage. In the United States House of Representatives, House Bill H.R. 676, introduced by Representative John Conyers of Michigan and Dennis Kucinich, is a plan for a universal, single-payer, not-for-profit healthcare system. The plan covers all healthcare needs, including dental, mental health care, vision care, prescription drugs, and long-term care. The plan is supported by 78 members of Congress, the 14,000-member Physicians for a National Health Program, and many other groups and organizations all across the country. The plan eliminates insurance companies' role in healthcare and uses the savings to fund coverage for everyone.
This should be the premier health care system in the world, and Americans should enjoy the best health of people in the world. And they don't, and I think we're responsible for that, and we should change it.
We can't do it by ourselves. We've got to look around and find who else in your community cares about this issue. Talk to people in your church, talk to people in your Kiwanis Club or in your Lions Club or your Zonta or Altrusa, whatever club you belong to. This is up to us. We should not sit back and let our legislators think that we don't care, because if we don't tell them that we do care and what it is we want changed, what kind of a vision do we have for the kind of healthcare system we want, if we don't tell them that, then we have only ourselves to blame. We need to ask our candidates where they stand on each of these issues. What are you going to do?
With a few exceptions, all of the current presidential candidates stand in one degree or another for maintaining the status quo. Republicans support insurance companies and are committed to a market-based, for-profit healthcare system. They oppose a national single-payer system. They emphasize personal responsibility. They push individual health savings accounts, although these would be predominantly available only to those who can afford them.
I have become absolutely committed to the idea of justice and fairness, and particularly a concern for the poor. That's part of the teaching of my faith.
Democrats have come out in favor of universal health care. What this means, though, varies with the candidates and does not really address the basic underlying problems of our healthcare system. One of these is employer-based healthcare. John Edwards and Barack Obama would actually make it mandatory for employers to cover their employees or else pay into a fund to help cover them. Hillary Clinton has said her plan, which has yet to be presented, differs very little from the other candidates. Why should we handicap our businesses? Mike Gravel and Dennis Kucinich are the only candidates from either party advocating a change away from employer-based healthcare.
Employer-based healthcare is not sustainable anymore. It's a huge headache for employers.
And insurance companies. Why do insurance companies run our private healthcare? Why do we allow profit to take precedence over the health of our people? No one else does. The monies that are wasted in administration, marketing, advertising, shareholders' profits, and executive bonuses could easily cover all of us with quality health care and actually save money.
What we need in a healthcare system is to put healthcare first, not shareholders, not a for-profit entity. We need healthcare that's focused on providing health for the people in the community.
Republican Mitt Romney signed a law in Massachusetts which covers everyone by mandating that every person be required to buy health insurance, much like people are required to carry car insurance. This is part of the idea of placing more personal responsibility for health care upon individuals. There are other factors involved, but basically this is a huge government subsidy for insurance companies and does not solve the underlying problem of insurance costs. Dennis Kucinich is the only candidate advocating not only eliminating the funding of healthcare through employers, but also eliminating the insurance company's role as providers of healthcare by establishing a national, single-payer, not-for-profit healthcare system similar to that found in other countries.
I think a lot of people were hesitant about supporting single-payer or healthcare reform or comprehensive healthcare reform because they were afraid that they would not be able to go to the doctor they were going to now, or would not be able to have the choice of their physician. And we've tried to emphasize that under a pooled risk or single payer, that you absolutely will be able to see the doctor of your choice.
There are any number of stories out there of people who have put off needed care for years until a crisis occurs, and then they wind up in the emergency room or in the hospital, and they can't pay for it, and we wind up paying for it. Why don't we all just pay for it right up front and get everybody on the same boat?
I think the only way things are going to change, especially at the federal level, is for the people to demand it from their representatives. When I've thought about this, thinking that if healthcare is a right, this is very parallel to women getting the vote, to the Civil Rights Acts that were passed in 1964. Those laws did not change because Congress saw the need to change it and wrote the law. The people demanded it of their representatives. And I think this is a parallel political experience.
And for those who say we can't afford it or can't do it, we can afford it, and we can do it if we want to.